Kia ora everyone, and welcome to the second popcorn panel, chatting about the Simpson report, brought to you by the Health Media. My name is Barbara Fountain and I am editor of New Zealand Doctor Rata Aotearoa. The popcorn panels are a place where we can get together to talk with colleagues who know more about their stuff than we do. On Tuesday night, we looked at PHOs and localities. Tonight, we are chatting about the issues arising from the recommendation for a Māori health authority. Working with me here tonight are Zara Shatama-Sepi, Martin Johnson and Tyler Brady. Sorry, Tyler. They will be watching out for questions and comments and passing them on to me. So please sit back and relax. There's no test at the end of this webinar. And first of all, we're going to start with a quick poll to see who's actually joined us tonight. And while you're doing that for us, I'll explain just how I think it's going to work. I will start with a few questions to our panellists, and you can start posting your questions in the Q&A space under the main Zoom frame. Also feel free to chat with each other in the comments section. Just be aware that we will be saving the comments and possibly using them in editorial coverage later, so don't say anything you won't want to see in a headline later on. We'll also be videoing this evening's session so that those who have missed out or can have a look at it later, assuming it all goes well. So please post a note to us if we suddenly disappear, because that's not part of the proceedings. And now I'd like to introduce our three panellists tonight. Peter Crampton is a Professor of Public Health in Kohatu, the Centre for Horora Māori at the University of Otago. Peter was a member of the government's Health and Disability System Review Panel. Welcome, Peter. He's coming to us from Dunedin, sorry. Keri Ratima Te Whakatohia is a GP in Opotiki. She has a particular interest in a health system which gives practical expression to Te Tiriti o Waitangi principles. Welcome, Keri. Gabrielle Baker Ngāpui is a former public servant and Māori health policy practitioner who now works as a consultant with clients committed to developing a pro-equity, anti-racist health and disability system. Kia ora, Gabrielle.
Kia ora.
Thanks to all of you for joining us tonight. Now, I'd just like to start by thinking about how we got here. In May 2018, then Health Minister David Clark announced a Health and Disability System Review Panel. A Māori Expert Advisory Committee was also established to help shape the review's deliberations. That was May 2018. In July 2019, the Waitangi Tribunal released its report on the primary care services, which found systemic bias in our health systems and among those who determine health priorities and funding matters. In September that year, the interim report of the review panel appeared. It appeared to take heed of the tribunal's findings, acknowledging the decades of poor outcomes for Māori. In its key messages, the interim report stated, I quote, "An effective treaty-to-treaty-based partnership must be developed with Māori to improve Māori health outcomes and to embrace a Māori worldview." I expect the interim report left many working in Māori health hopeful there would be significant changes for Māori health and governance when the final report arrived. Well, it did arrive last month, a little late due to the current pandemic, but it arrived in June. In an unusual twist for a consensus report, the recommendation for a new Māori health authority came with an alternative view signed by 10 of the 13 members of the review panel and the Māori Expert Advisory Board. We all know that structures alone do not ensure change, but this was an unusual development. So Peter, my first question is to you. Can you just explain how this came about and the implications of the alternate view?
Kia ora, Barbara. Yes, thank you, I will. And just before I do, can I just say kia ora to the two fellow panel members, Gabrielle and Keri, and also to everyone out there who's joined this evening. These are important issues, and it's fantastic that your interest and your passion for the area has brought you out, as it were, virtually speaking on a Thursday evening to join us. So, Barbara, the question was, how did this eventuality come about? Is that right?
Yes.
With the alternative view. Yes, and I'd just like to pick up on your use of language, a consensus report. The word consensus implies general agreement, not necessarily total agreement, and not necessarily, well, I think it implies a majority, let's put it that way. The panel was tasked in its terms of reference to give recommendations to the Minister of Health and to Cabinet about a health system that would be equity promoting and also sustainable in the future. And it's the first major review of the New Zealand health system, or let's say comprehensive review, that has occurred probably since its establishment in 1938 with the Social Security Act. It is a very comprehensive review. So one can imagine with that scope that there would be many areas of debate and many areas of disagreement that, in my view at least, is highly desirable. Had we all agreed on everything, it would be indicative of a poor choice of panel members, because it is out of the space of disagreement that rich discussions occur and also creativity occurs. We did not frame our work as being consensus-based, in my view at least. We had vigorous debates about many, many things, and including Holder Māori and the policy issues related to making recommendations that would promote equity and te tiriti and so on in the domain of Holder Māori for the future. There was disagreement in the panel on the issue of the functions of the proposed Māori Health Authority. So 4 panel members, including myself, plus the entirety of the Māori Expert Advisory Group, believed that a Māori Health Authority would have little value, or at least diminished value, without, unless it had a substantial commissioning function. That is to say, the power goes with the putia, the budget. In order to exercise influence within the system, we argued that the Māori Health Authority must have a commissioning function. And there's a rationale behind that, Barbara, which I won't go into right now, but we may like to discuss in due course. The chair of the panel exercised her prerogative, that was Heather Simpson, to not devote secretariat time or resources into exploring that particular commissioning function option and for the Māori Health Authority, and decided that the Māori Health Authority should not have that function, and the report is written in such a way as to reflect that view. Those of us who believe that it should have a commissioning function insisted on having an alternative view included in the report, and it is included in the report on page 173. I hope that answers your question.
Yeah, I must say that, you know, I've been covering health for a long time and I've read a lot of reports, and it was a rare development to actually have an alternative view supported by so many people involved with the creation of the report. So I take your point that consensus isn't just about everyone, and it's not necessarily consensus, but also that there is a lot of value in having a lot of different viewpoints on a panel of this nature. But still, I think a lot of people were pretty surprised to find, and I suppose we should give Heather Simpson her due, in that she included it in the final report. Was there any, you know, how did you manage to get that?
Well, we were insistent.
Yes.
I mean, I feel passionate about that, and fellow panel members do as well. Yeah. And also the Māori Expert Advisory Group, and also acknowledging the incredible input of the members of the Secretariat. And for those who are probably not aware, the Secretariat, which worked on this project for the full, well, it was more than 18 months, incredibly hard, numbered up to 20, I think, at the busiest time. So it was a lot of people. And there were some tremendous Māori members of the Secretariat who worked very, very hard. And to the best of my knowledge, we were all of the view that a commissioning function should be taken seriously. Now, there are a number of ways to handle, from a process point of view, a divergence of views. I just make that point, and it's not unusual. I think the tax working party, capital gains tax, became a contentious issue and had different views expressed in that report. The approach taken by our chair, Heather Simpson, was to include a 3-pager from the members of the panel who held that view. And I think any further discussion about that really needs to be with the chair of the panel.
Okay, thanks, Peter. I'm just going to have a quick look and see the results of that first poll and just see who's joined us tonight in terms of, whoa, there's a big chunk of others, and health managers, which was, we saw a lot of health managers the other night, which I think was really good. GPs, nurse, pharmacists. Oh, that's great. I think it's great to see the health managers in here. I'd be interested to see a bit more who those others are. I'm sorry we can't do any more categories. So Gabrielle, the Māori Health Authority is obviously just one element of the Simpson report aiming to tackle inequities in the system. Is it possible to miss other opportunities by focusing on this alone, or is this actually the game changer?
That is an excellent question. Kia ora, everyone. As I've been introduced, I'm Gabrielle Baker. I might just start how I would answer that by giving a bit of background about what I've been really interested in over the past 2 or 3 years. And that's this question of how do we make a health system that is that honours Te Tiriti and that is pro-equity and anti-racist. And I don't think one organisation is going to do that alone. Yeah. So I look across, when I looked at the report, I have to look at the whole thing and understand the context of all of the recommendations and ask, how do these relate to the most recent guidance we have on the treaty principles as they would apply in health from the Waitangi Tribunal's 2019 report, which you mentioned already, Barbara. So that's how I look at it. And I think with that context, I would like to see more in the report overall. I'd like to see the decisions that get made be bolder than what is recommended in the report. But I think if I had to pick one thing that I would focus on the role that Māori have in decision making on this. So a lot of the discussion so far has been on what should the functions of a Māori Health Authority, or whatever it ends up being called, have. And I absolutely agree with that alternative view that it has to have purchasing power, it has to have money. But I think more than that, it needs to have Māori decision making. And it's probably the way it's described as an independent departmental agency, where the Minister of Health still has the ultimate decision making, makes me question, how do we make sure Māori have decision making here?
It's interesting when you talk about that structure, when you look at the graph with the Māori Health Authority, the Ministry of Health, and then Health NZ. There's actually that big jump over to Health NZ is another issue for the Māori Authority.
And I thought that the other issue, just to briefly mention, is the funding of health services and of the health system overall, and some of those questions that are really important in the report about how do you have equitable funding? How do you have funding that achieves equity?
Just a question that occurred to me today when I was looking at my notes for tonight. It was, and I know you've worked in various agencies and ministries, and this is kind of the political side of it, but I mean, would you think there's a possibility that the government would be resistant to a Māori commissioning agency for health because it would set up a precedent for similar structures in other areas of social spending?
I think, I mean, that's, yeah, I mean, I had that thought myself when, after the report was released, a number of different groups are talking about the solution being a separate agency, and we had that same kind of thing raised around COVID and whether or not there needed to be a public health agency as well. And the report itself talks a lot about this, the issues that they identify being the result of fragmentation. So I think that there is something in that the report itself highlights. We can't be too fragmented because that's getting in the way of us achieving our goals. But at the same time, we need to be fragmented enough so that we can actually achieve the things we need to. So,
yeah,
sorry, it's a bit of a political answer, isn't it?
The things that haven't been achieved. So Keri, Aotearoa residents, we noticed today, have launched a petition calling for the government to support the alternative view. Now, you're a frontline clinician amongst our panellists tonight, and I just wonder, in the whole proposed structure that's been put forward, frontline clinicians sit a long way away from a Māori health authority, whether it commissions funding, if commissions services or not. And I just wonder what you feel the impact of the status of that authority actually has right at the front line.
I think one big area is around workforce, and I know that they talked in the report that that would be one of the first things that they would look to do. And there's been so many wonderful Māori workforce development initiatives, but it would be great to have those nationally coordinated and across the board.
Right.
I think that could make a big difference to us. And some of our, some of the workforce training is only 3 years, before we're coming out. Possibly some might be shorter, or some of our practice admin staff could be less training. But I think workforce will be a really good thing for us. And then, but in a shorter term, I think innovation. So I think that was another thing that they said that a Māori Health Authority would look to being one of the first 3 things that they did, because there's also some fabulous pockets of innovation, but it would be great to have a national Māori oversight of that and development. Yeah.
Actually, one of our panellists on Tuesday night, Jackie Cumming, one of her concerns with the review and the proposed changes was actually the time frame that everything was, the time it was going to take to get everything in place. And I suppose even with the Māori Health Authority, it's going, we're looking at a couple of years probably before a lot of these changes get bedded in. When you're talking about workforce, that's a long time.
It is a long time. So I think that's, more, what would you call that, the short to medium term, but hopefully innovation initiatives. There's some really great things that happen. For example, say we had some funding so that Māori women in Opotiki could get their IUCDs put in by other doctors within other practices, and we could do some referral amongst ourselves, rather than needing to, at the moment, practices are separate, and you might need to refer them, if there's no one in our practice that does it, to family planning in Tauranga or possibly Whakatane. So having some sort of innovation around making those types of long-term contraceptives much more available in our community through working together. It's because we have quite a competitive model at the moment.
Yeah.
Within our competitive model, we could have some innovation that helps us to, refer our patients around amongst ourselves to GPs have quite special interests in things. Yeah.
Okay, thanks. I've just seen we've got a question that's come from one of your colleagues down in Bay of Plenty, Emily Gill. I think it's kind of directed at Peter. She's just raising the issue of the makeup of the panel. She says although clearly 4 of the experts were supportive of the Tangata Whenua focused group, Tangata Whenua worldview was not represented on the original expert panel. Is this accurate?
I'm not entirely sure I understand the question, Barbara. So on the panel, there was one Māori member, that was Shelley Campbell. And in addition to that, there was the Māori Expert Advisory Group led by Aaron Shea. and that consisted of 6 members, all Māori, of course.
Okay.
I'm not sure if that answers the question.
Yeah, no, I think it probably does. There's
can I just jump in on that?
Sure.
A little bit? So during the Waitangi Tribunal inquiry into primary health care, there were questions asked about whether or not the Māori involvement in the review panel was sufficient. And what the tribunal said was that they appreciated the Māori expert advisory group and the skills that they brought and the Māori member of the panel, but that that was never going to be sufficient to meet a partnership assessment. So, kia ora.
Yeah. There's a couple of people who've asked a question, which it's kind of similar, is that what is the difference with regard to addressing ongoing health inequities between having a authority that can commission and one that can't? Gabrielle, I'll put that question to you.
Well, I mean, I think that Peter talked a little bit about this already, I think. So if you can't make decisions over how you're going to be spending the Māori health funding, it limits the impact you can have. So to me, when I read what the report itself recommends, rather than the alternate view, what it's describing is a bunch of functions that are already carried out by central government, even those innovation in the workforce funding. Those are things that the government already has as a role, as the things that the Māori Health Directorate within the Ministry of Health already do. So the thing that would set it apart is having this big commissioning role. So I know what that light version of a Māori Health Authority can do for equity. It's relatively limited.
Actually, there's another question that's come up, and it's actually said, well, if we're going to have a commissioning role for Māori health, why don't we extend it across all social services for Māori?
Well, indeed.
So Barbara, can I just comment on it?
Yeah.
I think that's a fantastic question. And of course, whānau order is a step in that direction. I completely sympathise with the sentiment behind that question. One of the technical terms a number of us came up with, and I liked on the panel, was sludge. The sludge in the system, which gets in the way of pro-equity Māori commissioning. And I just want to touch on that word commissioning, because someone else asked the question, what is commissioning? So the way I use that term is to describe the process of engagement with communities, needs assessment, service design options, decision-making, and then funding. And so it's the end-to-end process. That's what I'm meaning by commissioning. Others may use the term in a slightly different way. And to do that in a way where the needs of the majority don't get in the way of the needs of Māori communities has proven to be very, very hard for our system over many decades. And for me, there is more potential game-changing capacity in a purchasing function than there is in having that function re-embedded in mainstream organisations. I do not think it's a magic wand, but I do think it's got more potential to drive change than mainstream commissioning.
Actually, I'm a bit more organised tonight, because we learn as we go along, and I've got a few quotes stuck to my chair. One of them here was from Paparangi Reid, who was quoted in one of our articles. It will rely on the willingness of the wider health system to front foot all policy implementation and operations regarding equity. And I thought that was, if you don't have that driving power of commissioning, then you are relying on everybody within the system. So I'm just going to put up another poll, and this is, I've taken some of the elements from the report that also are looking to improve equity, and I'm just asking people which ones they think will be most effective. So here we go. And while I'm saying that, that last question was from George Arnold, and I think that issue around going out to broader social services, one of the things I liked in the report was the picture of the chap with showing that 20%, I think, of our health comes from health services, and so much more, you know, comes from population and all the other social services and environment. So here's our question, our poll: which of the following recommendations of the Simpson report have the greatest potential to improve equity in our health system? So we've got 50-50 Māori Crown representation on the Board of Health NZ, the proposed Māori Health Authority without commissioning powers, the creation of a legislated charter governing workforce behaviour, requirement that the DHB include provision of kaupapa Māori services into locality planning, ring fencing of funding for Tier 1 services, and none of the above. So there may be something else in there that has the potential to improve equity. So I'm interested to see what our attendees out there think of those questions or those answers. So I'll just give them a few minutes there. Okay, so actually so far most of our questions have been around the difference between what the current Māori Health Authority would look like with or without commissioning. So I suppose I'd like to just move on a little bit to well, hopefully some of the other questions that come up out from here, like the makeup of the Health NZ and how that body is going to relate to a Māori Health Authority. We've often seen power struggles at that senior level within government. We've had the National Health Board, we've had health funding authorities, and we've had a Ministry of Health whose role keeps changing. Peter, you mentioned earlier that the idea that the Māori Health Authority might see a lot of capacity go out of the Ministry of Health into a standalone agency has concerns attached to it as well. Would you like to comment on that?
Yes, well, I'll start off, Barbara, with a general observation. Many sector groups or interest groups or stakeholder groups, call them what you will, community groups, have argued for a standalone agency for their particular area of interest, be that cancer, mental health, disability, etc., public health. So there is I think, a natural and very understandable response that people have that if the Ministry of Health or the system in general they perceive it not to be meeting the needs of their particular community, then there should be a standalone agency. And my comment there is to caution a huge amount of thought is required and analysis to work out whether a standalone agency could be beneficial in this particular circumstances, given the known conditions that we have. And that's a context by, or an issue by issue discussion. To my mind, my personal view is that it's a very debatable point whether a Māori Health Authority, which does not have commissioning functions, should be moved out of the Ministry of Health. I think there are strong arguments to leave such an agency, as it's already, I mean, the capacity in the Ministry of Health is there, the Māori Health Team with the Deputy Director General of Health, Tony Whana, and it does good work and it's got growing strength, and it's very close to where power is exercised at the centre. And those are all very positive features of it. Now, if we stick it outside the Ministry of Health, away from where power is exercised, we are potentially weakening it. In my mind, we can compensate for that potential weakening if we give it a substantial commissioning function, and I mean really substantial, and we, as a system and politically, we support it to succeed. We resource it, we back it, and we ensure that the right sort of skills development occurs to maximize its chances of success. Now, that is a fairly challenging range of conditions I've just named. If we don't do that and we just stick it out to the side and ask it to do that very wide range of policy advice and monitoring activities and also commissioning in terms of workforce, kaupapa Māori innovations and other services, as is currently the recommendation.
Yeah.
I'm personally not convinced that, structurally speaking, it would benefit from being away from where the power and the budgets are held in the Ministry of Health. And I think that's an important discussion. And I acknowledge a little bit of an imponderable.
And I think the fact that we're still hanging on to quite a number of DHBs will further dilute, kind of in a way, dilute the power of that of the Māori Health Authority in terms of influence over. There's so many more people to influence. I'll just have a look at the results from that poll. What are we? Oops, Martin, can you just? Here we go. So, oh, that's interesting. So the 50-50 representation on the Health NZ is seen as having the greatest potential to improve equity in the system, and oh no, not closely, but not too far behind is none of the above. So it's quite hard writing these questions that don't come out with yes or no, but Keri, do you see anything interesting in those results?
I do actually, and I was just thinking back to, you asked me about the Opotiki community people that put in a petition around asking for Māori commissioning for the Māori Health Authority, and they had a public meeting at our library last night, which I went along to, and one of the things that they were talking about is that is about this 50-50 governance. And somebody brought it up earlier in their question saying, you know, is it not just health services, but is it not social services and all that other 80%? And there were quite a lot of discussions amongst the community about the concept of health. So if you have a co-governance arrangement and you have a group that's bringing a holistic perspective of health, and then you have an alternate view of health, that there's a lot more potential for gain. And like some of the people that were at the community meeting were talking about water and food sustainability, you know, these types of issues. But it did very much come down to co-governance in the discussions last night.
Do you think maybe, you know, we should be giving our communities much more credit for understanding that this is not, you know, that creating new structures is not going to ultimately be the answer to the issue of equity? That, I mean, there are so many community initiatives that are going ahead irrespective of what's going to happen at the national level. And obviously without national support and with that funding support, it's still it's a huge struggle. But, you know, part of the battle is getting people to understand, you know, it's not about whether you've got a hospital, it's about, you know, whether you can access it. I mean, do you feel like with your community that it's fantastic they're able to get together and talk about it? Are they optimistic? Is the feeling optimism, or is it feeling like they're battling, you know, the bureaucracy?
I think I just found that they were really looking for ways to have a voice, and that they wanted to have a voice about these different, you know, things that how they see health and well-being, and what we need to improve our health, whether it was water, or there was one Pākehā lady that was very interested in art for teenagers, and she was quite elderly, but she'd been running all these programs for, it sounded like forever, doing those types of things to help to strengthen youth in our community. And what I found really interesting was that and some of the speakers, they put up those pictures that we see all the time about equity and equality. You know, there's three figures.
Yes. Yeah.
Over a fence, and but the short one only has one box, and he can't see over them. They have one box each. Then on equity, the little short guy gets two boxes, and he can see over. But you know, so forth. But what they said is interesting things like, why don't you just take the fence down, and then no barrier? Like, but I just had never actually thought about the you know, the way that they see things is quite different. And yeah, it wasn't too focused on hospitals or access or getting their knee replacement as I might have expected it might have been. It was really from both sides, like the Māori and the non-Māori, it was really focused on a lot broader issues and ways of seeing health.
Peter, when you went into the review panel, and obviously the panel travelled widely around the country talking to lots of different people, initiatives and communities, I imagine from my point of view at that stage that people would have been pretty optimistic, that there was a real feeling that the system did need to change, that a lot of stuff was bogged down and people were looking for opportunities to change. Do you, for many of those communities, do you feel like the report has delivered on that optimism or that enthusiasm for change?
Oh, well, that's a really interesting question, Barbara.
That's good.
I'm not sure. Actually, you might have a better feel for that than I do. One of my reflections in response to that is that I'm not particularly a structuralist. I don't believe that there are easy structural solutions to many of the challenges facing our system. And I'm not dismissive of structures. I just don't think that changing the way we have the pieces arranged on the chessboard necessarily achieves what we want to achieve. However, I do believe at the same time structure can be very important. I do believe that leadership, culture of a system, values, behavior matter hugely. And it's very hard for anyone, including a health system review panel, to say anything which doesn't look anything other than lame on those points. Actually, we can state expectations, we can describe desired behaviours, we can talk about accountabilities, and we've done a great deal of all of the above. People skim over that and say, yeah, but where's the action? And structures will not determine behaviour or organisational culture or values. I believe those are a product of leadership and politics, both big P and small p. I personally believe very strongly in a te tiriti-based system and a very significant reset around te tiriti. I believe that any meaningful definition of haora or health includes within it the exercise of agency by individuals, whānau, communities, as being an essential component of the achievement of haora or health. And that set of conditions has never been achieved on a national level for Māori. So I believe a reset is required. And I feel optimistic and positive about the journey that New Zealand is on. I feel frustrated that we're so hesitant and fearful about progressing on that journey more rapidly. I strongly welcome Māori leadership and decision-making and authority into our health system and all areas of social policy. I mean, let's not get onto oranga tamariki and all the issues there, but it's another whole domain. The education system, there's been so much learning over the decades. So I feel very frustrated that we're not moving more rapidly as a society, but I feel positive that we are actually on a positive trajectory as a country, as a society.
So, so just on that, in terms of our trajectory, one of the panellists, Jo Scott Jones from down in Midland, has asked whether any of you have any feel for what the variety of what our political parties are thinking about the alternative view, you know, in the event that there may be a change of government. I mean, Gabrielle, you might be kind of closely attuned to these kind of things with the politics of the other parties.
I kind of can't answer that one, I'm sorry. I'm not entirely clear on, and I think part of that is because for me, devil's in the detail around the proposals. So I think that I'm probably putting my lens over it and saying, oh, people don't really know the specifics of it, so it's quite hard to form, you know, a strong opinion on it in a kind of political sense.
Not to mention the fact that our political representatives keep changing.
Exactly. I wanted to, I sort of wanted to pick up something that both of my fellow panelists talked about while I've got the mic, and it's because my preparation for this was to write myself one quote down as well on a piece of paper. And it came from Taihakuru Jury, who was asked during the Waitangi Tribunal inquiry about rangatiratanga in health and what that might actually look like. And he preferred to talk about mana motahake, right? So that was the concept he wanted to talk about. And he said that health policy will work best if it sits within a mana motahake framework that is community focused, that puts Māori in charge of the programs and that is directly negotiated with the Crown. And so that's the thing I think about when I look at the proposals, all of the proposals, not just the Māori Health Authority proposals. And so the appetite for a shift away from the status quo is also an appetite from my perspective for a shift towards not thinking that the Crown is the solution in itself, that the Crown has to be the one in charge of a Māori Health Authority and that has to be a Crown agency. That we have to have more imagination than that and think about how Māori can be in control of Māori health and that the Crown plays its role. And that role might be as the place that there's an agreement for an annual funding arrangement, you know?
That's actually really similar if you go way back to the early days of the National Party reforms in the 1990s, where they did try to introduce the independent health plans. And I thought that was an area where Māori were really interested in taking, where you would essentially take the money and plan and purchase and commission, provide you services. That was, but that didn't take off. It was one of the things they dropped. On that subject though, with the Emily Gill has also asked about whether there's any model worldwide where there is a dual governance of health that any of you would be aware of.
So could I comment on that, Barbara?
Yeah, Peter, yeah. Because you guys looked at other models around the world.
I'm not aware of any dual governance models.
Okay.
However, myself and 3 other colleagues on the panel and the Māori Expert Advisory Group believe that New Zealand could be a world leader in this. We believe it's possible to have an integrated system which also allows the expression of mana motahake and tino rangatiratanga and Māori authority, decision-making, mātauranga Māori, etc., built into it. I personally believe that's entirely achievable. And it would be an abandonment of our colonial past. It would be a maturing, it would be a moving on. I don't think there's any conceptual reason why that should not be the case. But no, I'm not aware of any off-the-shelf example which provides that, which illustrates that in practice. I'm aware of examples where Indigenous communities have been ceded authority to run health systems, but that's not dual governance, that's sole governance. And what I see is a partnership-based approach with real authority vested in Māori communities.
It is a time for optimism, even though we have a pandemic underway, because you know, one of the things I recall last year when hearing you speak about what the panel was trying to achieve, and that was that idea that we have a culture within the health system where everybody feels that they're working for the one system, and that's where you say, you know, structures don't do everything, that it actually has to be a culture and understanding. And that's one thing, I suppose, with our response to COVID-19. With the lockdown, we did actually display as a country that we could all kind of work together in one direction. And now, because we all talk about new normals, that as you say, we could be the country that makes it right in Indigenous health. and this could be the time for it to happen, because we do need new normals. So we've got another poll, which is about the likelihood. I just have to remind myself what this is. One, how confident are you the recommendation regarding the Māori Health Authority can be changed to include commissioning powers before the final structure is settled on? And I suppose that comes back to this optimism about whether we can actually do anything to influence the recommendations of the report. So folks out there, I'd love it if you could vote, and we'll see how confident we all are. It'd be great. And Martin, can you just move that poll so I can see the questions underneath it? So we're just getting, I'm just seeing what the time is, because we promised people an hour. So we've got about just over 10 minutes left. I'm having a quick glance down the questions to see if there's a short one.
Barbara, I was just thinking about when you asked me, did I think that the people in Opotiki were optimistic?
Yeah.
And actually I do, because they were, they saw this as an opportunity, and they've got so many ideas and wanting to have a voice. I think that to a degree you have to be optimistic to come out in winter to the library.
Yes.
Event about Māori Health Authority commissioning, and to be having all those conversations. So I think yes, they are optimistic. And you also asked about what we thought politicians might do with the report, whatever politicians we have.
Yeah.
And I just think that they pick out whatever they like and they just go with that. Yeah.
Oh, yeah, I do. I'm glad you were hearing optimism, because I think that's one thing about the health system is people keep on. Yeah, I feel. I mean, well, let's see what the answers to this poll are, and then we'll see if anyone else is feeling confident. How's that going, Zara?
You want to share?
Yeah, let's see what the results are like. Oh. Well, no one's happy with current recommendations, so that's optimistic for change. I'll look at it that way. And not confident. Yes, so I think there's a really strong feeling that that recommendation needs to change, and those commissioning powers need to be included with a Māori Health Authority before So the other thing I actually pointed when you raised that, Keri, is when I was quite surprised by the uptake of these popcorn panels, because when I originally asked these panellists, the first few panellists I approached, I said it would be really nice if we got a couple of dozen people who want to have a chat about the Simpson report, because let's face it, sitting around talking about large policy documents is not easy work. And the fact that in Opotiki, you've got people coming out to talk about it, I think is really amazing. So just coming up to our last 10 minutes or so, I might just go back to the panellists, and just see, are there any kind of particular thoughts you'd like to get off your chest before we finish up tonight? Gabrielle?
I've got a million thoughts, but you've only got 10 minutes. So I thought I might just address something that was mentioned earlier, that when we think about what other models there are, so I would really encourage us not to limit ourselves to what has happened in health as well. So Māori are familiar with a few other arrangements around the co-management of resources, right? And things like te ohu kaimoana are something that, we shouldn't just disregard as a model. There might be things in that. And when it comes to te reo Māori, te matawai, and the arrangements that have been set up from there. Sorry, Siri is trying to talk to me. Those kind of arrangements are things that are out there already, and yes, they're not in health, and yes, they're not in health services, but I think there's something worth looking at. And also learning from things that have happened in the past. So you talked about some things that happened in the 90s under the national government. One of the other things that happened was very short-lived Māori Health Commission. So this very short-lived Māori Health Commission was set up my understanding is kind of through a confidence and supply agreement. And I have to say it's my understanding because I went to National Library and they have one thing on it in all of their archives. And so it was a political decision. It wasn't embedded in anything. And so when there was a change in government, it just disappeared. And its functions did not include funding. So it didn't have the exact thing that Peter talked about. It didn't have any of those things that allowed it to have influence within the existing government structures. It was instead supposed to influence by working alongside a bunch of other agencies, including ACC. And when the one thing that the National Library has in its archive on it is a summary of the Māori Provider Development Scheme and the Hawara Māori scholarships. So the same functions that the review report recommends that this new agency have. And I mean, I'm not proposing a new poll, although I sort of am, but I just don't think it'd be possible. How many people knew about the Māori Health Commission of 1996?
Well, I didn't. And I'm pretty over all those old. I mean, I'm a bit of a hoarder. In fact, you find the policy documents sitting in my garage.
I might come to your garage.
Yeah, but one of the other problems I face is that all my old faxes have all faded to nothing. So I used to have all the press releases from throughout the reforms of the 90s, but that's just a hoarding problem.
Yeah, well, so I guess my point is that whatever we do has to be better than that.
Yes. Keri, have you got any final thoughts you'd like to share?
No, I'd just like to thank you very much. Yeah, it's been really interesting. I came to the other popcorn panel and I'll come to the next one too.
Oh, great.
It's nice to have a chance to learn more about the report in this way. And thank you to my fellow panellists as well. It's been great having them there and their wealth of knowledge. And to everyone else for coming out tonight. And I'm sorry if we haven't got to answer all the questions that we were hoping we could, but it's a good start.
Well, we will keep the questions, and I'm going to try and figure out what I'm going to do with them, but I feel like people have gone to the trouble of asking questions, and I'm going to put them in some kind of format and try and get answers to some of them. So that is an undertaking we've got here. Peter, any final thoughts from you?
Well, I would be willing to address any questions. I think there's some burning questions which we haven't answered, and I'm just not sure how we get a handle on what those questions are. So if anybody just wants to put in the chat window a burning question, I'd be happy to have a go at it. My burning thought is that the discussion about the commissioning function of the Māori Health Authority, or the proposed Māori Health Authority, is a really, really important discussion. And I just urge everyone to stay engaged with that, with the policy debates. Talk to your local MPs, talk to whoever you can talk to keep that discussion alive, to keep the issue debated, and to keep it on the political agenda.
Okay, and I'd just like to add to that, at the health media, we do feel a real commitment to the equity issue, and I've had my journalists out training, and we've pushed really hard to engage with folks in the Māori health area. And I know that one of the problems we face is all of you are so busy, and it's actually really hard to kind of take you away from your important work at the front line. But anytime, and we're just always open to talking to people about the issues that they face. On just another word of kind of promotion, a lot of you out there may not necessarily subscribe to the New Zealand Doctor of Pharmacy Today, but we welcome your subscription. And I've just got one last quote that I found in the report, which I really like, and I'm sorry I can't say it in te reo. It was a quote from James Henare. "You have come too far not to go further. You have done too much not to do more." And I think that's a wonderful way to finish off tonight. I want to thank our panellists very much for joining us, and also everybody who phoned in or Zoomed in tonight. Look after yourselves, stay safe, and we are back on next Tuesday talking about general practice. Thank you. Good night, everyone.